Today's May 26, 2025. We're looking at something historic in medical science, the world's first human bladder transplant. It took place just over 3 weeks ago at Ronald Reagan UCLA Medical Center. Ellie, can you give us some background?
Yes, the main story is a combined kidney and bladder transplant. The lead surgeons were Dr. Nima Nassiri from UCLA and Dr. Inderbir Gill from USC. Their teams spent over 4 years preparing, both on the surgical technique and logistical side. The recipient, Oscar Larenzar, lost his bladder after a tumor removal and both kidneys to cancer. He'd been on dialysis for 7 years.
So just to check, this was more than a simple bladder transplant. First, they transplanted the kidney, then the bladder, and then, importantly, they connected the new kidney directly to the new bladder. Did the kidney start producing urine right away?
Exactly. That's crucial. The new kidney worked right away, producing urine that flowed into the new bladder as it should. Oscar no longer needs dialysis. That's a significant improvement in his quality of life.
Why hasn't anyone tried a bladder transplant before? We've seen heart transplants, lungs, even faces, but not bladders.
The main barrier is anatomy. The bladder's blood supply is deep in the pelvis and pretty complex. Lots of small arteries and veins. Plus, the tissue is unique. Connecting all of that is technically tricky and carries risk. The team actually developed new approaches. For example, they pre-connected some of the donor's blood vessels before transplanting, which made the actual surgery safer and faster.
And they practiced on deceased human donors with functioning hearts, right? Not just animals.
Correct. That was a critical step. The teams practiced robotic retrieval and transplantation on deceased human donors at UCLA, at USC, and with One Legacy, the local organ procurement group. Over those 4 years, they kept refining the technique so they could handle the pelvic blood supply.
Let's get into why this matters. Right now, people with severe bladder dysfunction usually get part of their intestine used as a replacement bladder. But that has major risks. Can you explain?
Sure. The intestine and bladder are very different organs. The digestive tract has its own microbiome. So when you put intestinal tissue into the urinary tract, it can lead to infections, bleeding, and even a higher risk of cancer. According to Dr. Gill, about 80% of those cases involve complications. A real bladder transplant could avoid those problems.
But there are still questions. How well will a transplanted bladder work long-term? Is there a higher rejection risk compared to a kidney or heart?
Exactly. It's still early. Oscar Larenzar's recovery looks good so far. His kidney function stabilized right away, and the new bladder is working. He'll need immunosuppressive drugs, just like any other transplant patient. But the field still has to learn more about long-term rejection risks and the best ways to monitor patients.
There's also the practical side. Donor organs are already in short supply, and now bladders are part of the equation. Plus, only a handful of centers can even attempt this right now. How do we make sure access is fair?
That's a big ethical challenge. At the moment, access will probably be limited to people with good insurance and those near major hospitals. Over time, the field needs clear guidelines: who's eligible, how organs are allocated, and how to support patients during recovery and follow-up. If not, new advances like this could actually make healthcare disparities worse.
So we've got a breakthrough that could help millions with bladder dysfunction. But the challenge is scaling up, on both the technical side and the access side. Will insurance cover it? Who decides which patients get it? These are the next hurdles.
That's right. But even so, this is a major step. The fact that a human bladder can be transplanted successfully opens the door to more innovation in organ medicine. It's really a new chapter.
So just to sum up, the first human bladder transplant took place 3 weeks ago at UCLA, combining a kidney and bladder in one patient who's now off dialysis and able to urinate normally for the first time in years. This required years of preparation and new surgical techniques. There's hope for wider impact, but also real questions about access, ethics, and long-term outcomes.
Thanks for following this story with us. We'll keep tracking developments in organ transplantation.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.